OK, now do stay tuned because in a moment I will be talking to the Chief Executive of Somerset Partnership NHS Foundation Trust. James Heappey is with me now, the Conservative MP for the Wells constituency, which of course includes Shepton Mallet. Morning, James.
Morning, Claire.
Your reaction to this?
Well, I mean, as you said in your introduction there, this isn't a cut to the number of beds, and therefore the provision of inpatient beds in community hospitals in Mendip is unaffected, and that is obviously to be welcomed. But beyond that, I guess I have three key concerns. Firstly, why are we still so struggling to recruit clinicians into the county? It's becoming a real issue. Secondly, we need some assurances over the long-term future of inpatient beds at Shepton Mallet. We've campaigned hard to keep inpatient beds at that hospital, and I want to be confident that this genuinely is a temporary closure and that their long-term future is assured. And thirdly, I want to be reassured that this in no way affects the plans for the redevelopment of Shepton Mallet Community Hospital into the health campus that we've all been so excited about for the last few years and that we thought we were so close to achieving. This should hopefully just be a temporary setback and nothing more permanent with that regard.
We say temporary setback. I mean, you brought up staff shortages. Your government is in part responsible for nurse shortages, isn't it?
Well, as you know, Claire, there are more nurses going through training than ever before. I think the issue is not quite as binary as that. There's obviously a challenge in recruiting clinicians into community healthcare in Somerset, and that's what we need to be addressing.
So how are you addressing that? I mean, I've had a text message from Johnny today who said, more NHS closures. I don't believe it. If you don't make the job financially attractive to new generations of staff, we'll just have more closures to come. How can you make this attractive to people? What can you do as an MP? What can your government do to get this sorted?
Well, I think that this is a challenge for the Somerset Partnership Trust and the Clinical Commissioning Group with whom I've been working on this. I mean, it's the same issue with the temporary closure of the A&E in Weston-super-Mare. It was a struggle to recruit clinicians. These have been issues for a number of years. They're not things that have happened in the last year or two. There is... for a number of reasons. We could talk for an hour about it, but there are a number of challenges in bringing people to a rural area to do community healthcare. That goes for GPs, it goes for community nurses, and it goes for clinicians in our hospitals. What we need to do is look, as we've discussed previously, at whether or not you could offer some sort of incentive for people to come down here. There are other counties like Lincolnshire, for example, that offer a golden hello for clinicians who come and sign up to work in their county. I know the CCG has some concerns about that as a model, but it seems to work elsewhere, and I wonder whether it could work for us in Somerset too.
And could that be an answer for an immediate resolution to this? We talk about long-term, what needs to change. Is there an immediate resolution to this?
Well, I'd like to hope so. I mean, if you look at what they're doing in Weston at the moment in order to recruit the people they need to reopen the A&E at night time, they've gone overseas, and the government has been able to support them in doing that by expediting the visa process for the people that they recruit. So there are immediate solutions that we could pursue, but those are really sticking plasters on a sort of longer term, wider issue about getting clinicians into Somerset, and that remains a big challenge. As I say, not just for nurses in community hospitals, but for GPs and people and clinicians in our hospitals as well. You know, we've just got to I think very carefully and imaginatively about how we make the offer as attractive as we possibly can, because there are plenty of clinicians out there. It's just that we need to find a way of tempting them away from where it was that they trained at med school and university and get them to come and deliver their brilliant skills for us in communities like ours in Somerset.
James, thank you very much.